The Department of Health hosting a two-day traditional medicine summit in Ekurhuleni. The summit seeks to give a platform to stakeholders in traditional medicine sector to meet with the department and discuss how to advance and formalize the sector into the national healthcare system. The summit is also part of the resolutions taken at the level of the World Health Organization and African Union to integrate traditional medicine into health system. To take this discussion further, we're now joined via Zoom by the Deputy Director of Traditional Medicines at the Department of Health, Mr. Bruce Mbedzi. Thank you so much, sir, for your time this afternoon. Now, of course, this is a very significant summit, I would imagine. Now, speak to us about the significance of the coming together of traditional medicine practitioners, across the country.
Yes, indeed. Thank you, Unati, and also greetings to your viewers at home. So it is significant because this is the first summit that the department has called for the stakeholders in the traditional medicine sector. So it is important that because we are trying to in our endeavor to include traditional medicine in the primary healthcare systems, we need to engage and agree with all our stakeholders on the way forward in terms of implementing the legislations that are there in this regard. So the summit actually was called by Minister actually in order to discuss all the outstanding issues and all the issues that are impeding the department in implementing the legislations or implementing the frameworks that are intended to include traditional medicine in the national health systems.
A lot of, people in South Africa, understand the importance of traditional medicine. But COVID-19 really exposed the gap between Western and traditional medicine. We saw how many people were actually leaning, to traditional medicine when the pandemic hit. So talk to us then about how will this particular initiative help bridge that gap that we speak of between, Western and traditional medicine to ensure that, both ways are recognized and also practiced, within the proper guidelines of the health system.
Yes, I'm sure you're aware that currently the traditional medicine is operating outside the national health system. So there are no frameworks that have been finalized to make it possible for them to work within. And then the gap that you are indicating during COVID-19 exposes the clients to be vulnerable because they are attending to the services that are provided by traditional health practitioners who has not been vetted or who are not being regulated or registered with the council that should be regulating them. So this process is going to close the gap and also to make it possible for the two systems, that is the conventional system and the traditional medicine systems, to work together. And by saying we are including traditional medicine into the national health system, we are not saying that they are going to work in the same facilities. We are creating a space for traditional medicine to operate parallel to the conventional medicine.
And one wonders, Mr. Mbedzi, why it's taken so long, because, we know, of course, that the World Health Organization, as well as the African Union, they have, taken some resolutions in essentially what you're saying, in how do we have, a conventional medication as well as traditional medication working in parallel with each other. Your summit is going to discuss some of those resolutions. But where do you think the problems lie in terms of just the time frames of getting us this far?
Yes, remember that WHO and the African Union provide member states with guidelines, and then it is up to the member states themselves to implement the agenda. But currently in South Africa, I think the agenda has been driven since 2007, when we passed our first legislation to try and include traditional medicine into the national health system. And also the department has went as far as creating a directorate at the national level, which is supposed to facilitate the development of the relevant frameworks, such as policies and legislations and other regulations.
So what happens after the summit? Just speak to us very high level. What are some of the key issues then that you will bring forward, particularly within the Department of Health, and will be implemented?
The key issues that were discussed as the summit is to implement the frameworks that I was talking about. We already have the Traditional Health Practitioners Act, which provides for the council, for the interim council to be appointed. So we need to move forward in implementing the legislations, and also we need to move forward in finalizing the policy on traditional medicine in South Africa. So we were discussing all the issues that were not making it possible for the department to move with speed in implementing those frameworks. So what we have achieved actually in this summit is that we had a lot of representation from the sector, and then we discussed all the issues that were impediment to the progress on the implementation of those documents, and then we came to an agreement that it is necessary that those documents or those frameworks be implemented going forward. So we have actually been given a mandate by the sector itself to say, go forward and implement all these frameworks, and then where there are gaps or where there are problems, we still have an opportunity to sit down and correct them. And that's what happened actually in the past 2 days.
All right, let's leave it there for now. Thank you so much for your time this afternoon, Mr. Bruce Mbedzi. He is from the Department of Health in charge of the traditional medicine space.